Hey gang, Joel Palmer here. There are very few injuries more debilitating than a lower back injury. If you know of anybody, or if you yourself have ever had one, you know that it makes the most basic tasks of everyday life very difficult. In fact, oftentimes just getting out of bed or in and out of a chair is near impossible. So what I'm going to show you today is just a few simple things you can do for that acute phase of injury. There's a lot you can do for prevention later on and for rehab during the subacute stage. But for that acute stage where you're just so in so much discomfort and you're so disabled by the pain, research has shown that the best thing is to not just sit around or lay around and do nothing, but to do some simple things. So we're going to do just a few simple movement patterns. I'm going to show those to you in just a second. I want to make a disclaimer though. We're working on mobility. They are not traditional stretches, quote unquote. Stretching is oftentimes counterproductive in the acute phase. It just triggers oftentimes more spasm and more inflammation. Once the spasm and inflammation has died down, then your stretches do serve a purpose later on. But when you're acute, we're working on mobility. Most people who are in that acute phase will find that even just simple movement tasks, you just try to get down to put your shoes and socks on in the morning, darn near impossible. So we're trying to just move things in a gentle fashion, and I'm going to get myself on the floor here in a second to show you just a couple simple movement exercises that I like to use. So check back in just a second. Okay, so I'm going to show you some of these from a couple different angles just so you can get a good view of what we're doing here. Most of them are floor exercises. I realize in the beginning, sometimes when you're really acute, just getting up and down off the floor is difficult. So if you have a firm bed, you can oftentimes do these right on your bed. It might be a little easier because getting all the way down to the floor and then certainly all the way back up, it can be difficult. So if your bed is firm, if you've got a soft, cushy, pillow top, squishy, marshmallowy kind of bed, forget it. It's probably counterproductive. So you're better off on the floor. So the first one we're going to do is something called toe in, toe out. Simply on your back, taking your toes. You see them, we're going to toe out to toe in. Toe out, toe in, right? Out, in. And with all these exercises, you're going to tolerance. In the beginning, you may have very little toe out, toe in motion. That's okay. You're just moving slowly and rhythmically through the pattern. Don't try to force anything. Don't try to move too far. Okay, so that's the first one. Toe out, toe in. The second one is something called the pelvic rock, and all you're doing here is pressing your lower back straight down to the floor. So you're just sort of pressing and relaxing. Now you only press as far as you can handle. If it gets painful, don't try to push through the pain. So from the side, you'll see me here. So we're going to take that lower back and just press and release. I would just let the head lay right on the floor and just press, release, press, release. And it's just a rhythmical pattern. So you're not holding for a long time in the press position. You're not trying to stretch or really force anything. You're just rocking. That's why it's called a pelvic rock. The next one would be a knee rock. And again, only allow your knees to go as far as you're capable. In the beginning, you may only have a few degrees of rock. Okay, when you're healthy and normal and your back is not a problem, you can probably go all the way to the floor. That's fine. But in the beginning, when you've got a lot of spasm, swelling, inflammation in that lower back, you're probably not going to be able to do that. So just go to where you can. Right and left is one repetition. Right, left. You can count reps if you want. You know, in the beginning when people are really acute, I don't really care how many reps you do. I just want you to go through the motions, spend a little time trying to. So just go with what feels good to you, okay? A little bit of repetition side to side. So from this angle, what you'll see is the knees are rocking side to side, right? If we were doing full motion, it would be all the way back. A variation of this that I would add in addition to, not as a substitute, but in addition to, is a figure 4 knee rock. Take your right ankle, cross it over on the left knee in this figure 4 position. And again, you're just rocking here. It gets a little more sacroiliac work, engages the glutes a little bit, just kind of works that lumbopelvic area a little bit differently. Again, in full range of motion, you'd be all the way side to side, right? Again, from this angle, right? We'd be full motion side to side. In the beginning, again, don't force it. Go where you can handle. Go where you can handle. Just a nice sort of rhythmic rock. We're not forcing it. Okay? Those are ones from that position. From the all fours position, I like traditional cat camel. Okay? And again, we're just going to round and extend to whatever degree you can, right? And again, in the beginning, probably not as much range of motion, so keep it simple. We're just after the top and the bottom motion that you can handle. Okay, again, as you get better or in normal circumstances, you might be able to round and extend pretty good, okay? But when you're acute, it's a whole different ball of wax. So again, the cat camel from the side, round, extend, right? Round, extend. Don't overdo. Remember, it's just what you can handle. What you may find is you feel more comfortable one range versus another. You know, if you've got sort of a lot of inflammatory stuff in the facets, a facet jam, say, you may find that extending actually doesn't feel all that good. So don't worry about it. Stick with what you can do and just work in that range of motion. All right? The other one I like from this position is just sort of a modified sort of child's pose. And all we're going to do is push back, rock forward. Rock back, rock forward. Rock back, rock forward. You know, as you get better and you get back into your normal range of motion, like a full child's pose, modified child's pose might be, you know, much lower. But you go to where you can handle, okay? So if all you can do is that, then that's all you do in the beginning, okay? Don't worry about how deep you go. We're just trying to get some motion in there and try to reduce some of the spasm, get some of that tension to release in there. One more I'll show you is from seated, cross-legged rotations. So, you know, you're sitting sort of like a kid, right? Crisscross applesauce, right? Here we go. And then all you're going to do is reach around to the opposite side, bring it back, reach around. I would keep the hands. This is vital here, especially when you're acute. Don't reach way out. You don't want to lean over too much. You want to stay fairly upright. Keep your hands right in close to you. They should just slide from side to side. I'm not really pulling. I'm just gently reaching, okay? Just gently reaching. These are a few things you can do when you're in that acute phase. Later on, when we're trying to rehabilitate and recover, we're out of that acute spastic inflammatory phase. Later on, there's a whole bunch of other videos on my channel that you can go to and start using. I would start with the VFSV simple home low back exercises, and then there's a bunch of other ones on there that incorporate things like a Theraball, and then as you progress even further, then we get into some stuff with, you know, some kettlebell training. But in the beginning, when you are acute, this is the kind of stuff you're looking to do, and you can do these things multiple times a day. What I would suggest is first thing in the morning, get up and just get mobile for about a half an hour before you try any of these. If you're really finding that, you know, every morning it's just miserable trying to get out of bed, you can do a few of these particularly the ones where you lay on your back, you can try doing them very gently in bed and then see if that helps you get out of bed in the morning. Here's one more tip. I'm going to leave you with that, just because this is an issue for people, is getting up in the morning, getting out of bed. Do not try to get up doing a sit-up. So for instance, you throw your covers off, the alarm goes off. Don't try to do this first thing in the morning. Never. Even when you feel good. Don't do that. What you want to do is turn to a side. So if you were in bed and I was going to get out of bed on the right side of the bed, right? Roll to your side first. Tuck yourself up in sort of the fetal position, and then use your hands and your arm here to push off the bed to sit yourself up. And then obviously your legs would swing off the edge of the bed. Okay? So just another tip for you. So try these when you're acute. Hopefully you get out of that acute phase pretty fast, and then you can get back into your rehabilitative phase, and then eventually get back into the gym, because nobody likes missing workouts. So there you go. So I'm Joel Palmer. This is Vintage Fitness, and check back for other videos. Thanks. See ya.